This episode is proudly brought to you by the TPG Telecom Foundation, dedicated to creating opportunities to improve the health, wellbeing and education of Australian communities in need. Hi, I'm Megan Gilmour, MissingSchool co-founder and CEO, and this is Live&Learn. This is the podcast that unearths insights at the intersection of health and education, building a powerful alliance to keep kids with complex health conditions connected to school from anywhere. The podcast is recorded on Ngunnawal land, and we acknowledge and pay respect to the traditional owners of this land and the land on which you're listening. Welcome to our weekly webcast, a place to zero in on the interplay between health and education and to amplify the voices of those supporting school students to navigate their educational journeys despite complex health challenges. And today on Live&Learn, we have Michelle Lim with us. Associate Professor Michelle Lim is the CEO and Scientific Chair of Ending Loneliness Together, a Principal Research Fellow and Co-Director of the Social Health and Wellbeing Group at the University of Sydney's School of Public Health, and a practicing clinical psychologist with over 20 years of experience. Michelle has led key Australian reports on loneliness, advises governments and industries, and is considered the country's leading scientific expert in the field. Internationally, she has co-founded the Global Initiative on Loneliness and Connection and serves on the World Health Organization Social Connection Technical Advisory Group. Welcome, Michelle. We're so excited to have you on Live&Learn.
Thank you for having me, Megan. I'm really excited to be here for MissingSchool's Live&Learn.
Right. Well, we're here, as I said, Michelle, to talk about supporting school connections for students with complex medical and mental health conditions. So let's dive right into the questions. Tell us about the impacts of loneliness and why it's something every Australian needs to know and care about.
Yeah, brilliant. And before we even kind of go into that, just to make sure that everyone knows what loneliness is, it is a subjective feeling of distress that comes up for you when you feel your relationships do not meet your current social needs. So it's something that is a subjective experience, different from social isolation where you might be physically alone. And so in the last probably 20 years, we've already known for a very long time in the scientific field that social isolation is actually bad for our mortality, our health, our well-being. But now it's not just being physically alone that actually hurts us, but also feeling alone that also hurts us. So I would say in the last 20 years, there's been a huge acceleration of interest, of science, of research into this area, looking at the impact of loneliness on both our physical and mental health.
That is certainly something that every Australian needs to know and care about. And thank you so much for setting up this conversation with what is a deep capture of loneliness and at the same time simplifies it, I guess.
Yeah, I think just to add on as well, and hopefully people do understand this well, because loneliness itself is not a pathological condition. It is a very innate feeling that does come out so that we can do something different and take action to do something about our relationships. But when we kind of talk about addressing loneliness, what we really are going to try to do is to address or basically slow down the onset of what we call more persistent loneliness, or basically delay that or arrest the development of making sure that if we do feel lonely, we're not staying lonely. So what we're really trying to do is address kind of more persistent loneliness as opposed to saying that we're not allowed to feel lonely, because actually we all do, you and I, and anybody who has a beating heart should feel lonely at any given point.
Yeah, and I think that's a really hopeful place to start as well. So many people probably do assume things about loneliness. You've tapped into that a little bit in your first answer there. But what's the million-dollar question you get from, I guess, parents or loved ones of people experiencing loneliness, or just people experiencing loneliness?
Well, we know there's a lot of shame and stigma and misconceptions about what loneliness is and what it's not. So, in our last year in the State of the Nation report that we released at Ending Loneliness Together, we found that, 1 in 2 Australians would actively conceal their loneliness, and feel ashamed when they do feel lonely. They feel like they don't have anyone to talk to or to turn to, that if they are not by themselves physically, they have no right to feel lonely. And that's a huge misconception, because while they are related, so if you are physically alone, it may uh, lead you to feel more lonely, so you're more predisposed. It doesn't work the other way around. So just because you're lonely doesn't necessarily mean that you become more and more socially isolated. In fact,
Mhm.
loneliness itself, you can be lonely in the crowd, lonely in the family, lonely at school, lonely at the workplace, lonely in your community. So it's about this idea where we don't really know who is lonely unless we ask them, because it takes a lot of a really trained eye to kind of do a rough guess that someone might be lonely. But people, even when they are lonely, often say they try to deny it, or they maybe sometimes don't even recognize it in themselves, because
Mhm.
they themselves don't think that that's how they should be feeling.
Mhm. And I imagine there's some masking that goes on there too, with that complexity of attributing it to other things, or perhaps
Absolutely.
acting out in a way that might not support connection,
That's right.
but it's a cry for help
Yes.
around loneliness. Yeah, and I'm sure we'll get into that a little bit more as we move through.
Mhm.
When in your work, and when you're hearing these things, what's the most important thing that you want people who are lonely, who are feeling lonely, to know?
I really want to normalize that experience for them. I think that it is really important to know that they're meant to feel this way. This is our system working appropriately.
Mhm.
We should feel hungry, we should feel thirsty, and we should feel lonely. And what it really means is that we need to sit back and reflect about what we need, because perhaps our social environment is really not catering to what we really desire. For young people, sometimes they desire more relationships. For older people, they desire more high quality relationships. So it's around, how do we get those relationships that we desire? And if we don't get those, what's the next step? And sometimes it's important to remember that we don't have to make big changes or actions for us to get there. Often the solution is very feasible, small steps that we just make little bits of effort to kind of get to where we want. And maybe finding that meaningful, healthy social connection is one of those things that we chip away at. We're not meant to have our next best friend right away. This is something that we work towards over a period of time, where we bake those sorts of meaningful social interactions into our routine and build relationships very organically over bits of period, and kind of, changing strangers into acquaintances, acquaintances into friends.
Mhm.
We kind
Mm.
of take those steps and not put too much pressure on ourselves.
Yeah, wonderful. And what I'm hearing there is that being connected is a skill to develop.
Yeah.
And I suppose that requires us to tell ourselves a different story um, about loneliness, as you're saying, which is it's completely normal if the experiences in your life aren't matching your desires, which you've said can change across the lifetime as well. The kinds of things that connect us can change, the relationships, quality versus quantity, and all those sorts of things.
Mm.
And that there's not something wrong with us if we feel lonely.
No, you're very
That's what I'm
normal.
hearing too.
Yeah, yeah.
But I think that sort of experiencing loneliness as if it's an outcome of our inadequacy would stop us from practicing those skills that you're mentioning as well, so that as what we're saying to ourselves about our worth or something else.
Yeah, and I think this is we're really, um, how a lot of people feel about loneliness is really a consequence of many years of misconceptions being, uh, reiterated in the media, that, oh, you're a loner or you're by yourself, so you must be a lonely person and nobody wants to be friends with you. And that actually is a very unhelpful connotation.
Mm,
And in fact, it doesn't help. And people forget that, um, again, we might feel lonely in that moment, but what happens is that there's a lot of things that are outside our control that
mm,
means that we stay lonely. So things that we can't control, and maybe not even about our personality or about anything about us, that
mm,
actually keeps us lonely. So you know, for many of your listeners out there, that almost 1 in 3 Australians will report loneliness at any given time, but 1 in 4 Australians report what we call persistent loneliness. So that is loneliness that if we follow this group, 1 in 4 Australians will say they're lonely up to 16 weeks from when we first ask them. So their environment, there's something about their environment that doesn't support them to build those meaningful social connections. And there are barriers, as you would know, with many young people, with many people who might have health issues, for example,
mm.
not being able
Yeah.
to access school or not being able to quickly go out into a rich social environment. They're living in impoverished neighborhoods or they're living in an environment where they don't have a lot of control. So normal to feel lonely, not helpful to stay lonely.
Mm. Yeah, incredibly important distinction there, and also um, some rather impressive statistics to put some perspective around the fact that loneliness is a universal experience,
Yeah,
feeling, like you've said.
yeah,
But persistent loneliness is something else. And then to just come back and link in um, the very important fact that prolonged loneliness has physical health implications as well as mental health implications, and that is why it's so important for us to express our agency in addressing that.
yeah.
Um,
So
Michelle, oh, sorry, go ahead.
yeah, I was just gonna to add to your point. I think when we feel like we don't have those meaningful social connections, we tend to process that as a bit of a threat in our brains.
Mm,
It's a biopsychosocial stressor. So that's why you have these implications to our health, to our mental health and well-being. We're less incentivized to want to stay well. We're less incentivized to exercise, to eat well, to do all that health regulation behaviors that are really critical to us.
mm. Thank you for putting words to that. Um, I'm just going to check in. A biopsychosocial pressure. Is that what you said?
Stressor, stressor.
Stressor.
Yeah,
Okay, a biopsychosocial stressor that then leads to other um,
yeah,
health
yeah,
engagements or otherwise, yeah, things
yeah,
that are healthy
yeah.
or not.
Exactly. Less likely to follow your medication schedule, those sorts of things.
Oh,
Less likely to go to the doctor because no one's nagging you and pressuring you to go. Those sorts.
yeah.
Yeah.
And I guess because that's hardwired in, what we're saying is that humans are designed for connection
Yes,
to
absolutely.
have.
Yeah, absolutely. You're right. So again, we're back to, needing that healthy, meaningful social relationships is critical to us humans.
Mm,
Survival, that's how we thrive, that's how we flourish. It's really, in our DNA to be with people who take care of us, who has our back, who we can turn to and talk to when there's trouble. But when we feel like we don't have that, in whatever context we're in, whether it's at school or work or home, that's where we know that it will lead or will be more predisposed to kind of future health problems.
yes, and I think you said there for prolonged periods, we experience it as a threat. Did I hear that
Yeah.
correctly? Yeah.
Yes. Yeah. And in many ways, even in a short periods, we experience it as a threat. But when we don't do anything about it,
Hmm.
and
Hmm.
this is where stigma and shame really doesn't help because we
Yeah.
put that upon ourselves as really us as a community saying, oh, it's so shameful to be lonely, or you shouldn't feel that way. You should be fine because you're in a family and you've got kids and you've got friends at school. You should not feel that way. Why should you feel that way? And we put that on us. There's our
Mm,
community say you shouldn't feel that way. When in fact it's normal for us to feel. It's actually
yeah.
a good thing and a healthy thing for us to do something and to react to it. But we're not allowed to. We don't know where to go or turn to. Where do we get help? Because it's shameful to say that I'm lonely or I need friends. Um, so we need to find a way of having this conversation where if I ask you, oh, do you feel lonely? And if you say yes, my immediate response is to say, oh, what should we do together? And not take it personally, because sometimes people take it personally to go, oh, why should you feel lonely? You've got me, that sort of stuff.
Uh-huh. Yes, yes, I hear what you're saying. Yeah.
Exactly.
And I think I predict that we're going to get into a little bit more detail about what the components or what social connection is, like what are the features of that, and why would
Mhm.
loneliness occur even in a crowd or with
Mhm.
a
Mhm.
family in your home. And
Mhm.
so that's really interesting to me, and I'm sure to the audience. Before we jump into that, we'd love to know, Michelle, what brought you into the world of
Mhm.
loneliness?
Yeah. So you mentioned that I was a psychologist by training. I've been in practice for 20 years now, both in the public system and the private system. And when I was training as a young psychologist, I was, I chose a field where I was really catering to probably the one of the more severely disabled community uh, people with who experience what we call chronic psychotic disorders. So people, even after we treated them, would still experience hallucinations and delusions. And their level of care is so high to the point that they often live in group homes. They're often living with elderly parents because they have to be cared for, and services would see them maybe 2 or 3 times a day. But despite the high amount of contact and high amount of, care that we do give this vulnerable group, this group of people still complain of loneliness. And it really struck me how our care industry really don't really prioritize social care at all. In fact, we might only think about their social care, perhaps if we want to discharge them off our books. And so I decided to do a PhD in looking at social relationships and how that can buffer the distress of mental ill health. And that kind of led me into the field of loneliness unexpectedly. It wasn't something I planned. And, I did a bit of training in the US around loneliness and social anxiety. And when I did come back to Australia, you know, really kind of connected with people with lived experience who said, look, we really need to do something about this issue. And we need to look at the UK and look at other countries in the world that they're kind of addressing this now. We need something in Australia that makes sense. And can we use the evidence to really inform practice and policy here? And that's what
Mm.
anyone that's together does.
Yeah, fantastic. Thank you so much for sharing that. We often get this answer that's some kind of circuitous process that people go through in their lives to arrive at their particular thing. And well, they never intended, never set out to do that, but that's
Mm.
the discovery along the
Yeah,
way.
absolutely.
And I think that connection is so important as well.
Mm.
So if we move a little bit more into the sort of the health, people with health conditions space,
Mhm.
knowing all that you know, what's your biggest hope for
Mm.
people experiencing loneliness, their families and loved ones, when navigating a health crisis? So where that loneliness is in the context of that person having a health crisis or a
Yeah,
serious illness.
yeah. I think we do know very, very clearly that people with chronic disease as well have about a 2.6 times higher chance of being persistently lonely. So this is an incredibly vulnerable group. Having to attend to your physical care and mental health care um, take you away from building the meaningful social connection that you need.
Mm,
And ironically, sometimes the need to recover, to accelerate your recovery. And so it's a very difficult time for a lot of families to manage their connections and chronic disease. One thing that we really need to do and really advocate for is that how do we encourage social care when people are going through a health and medical crisis? Because
mm,
doctors are very good at um, knowing what to give us in terms of medication, but they don't know how to better support people as they go through this journey,
mm,
you know, and it's often um, sent to the social workers and interventions and solutions may not be very enough for someone to uptake those solutions, or maybe it doesn't work in their context. But how do we better support people so that they can recover or they can manage their health crisis a little bit more? Um, I do see some interventions out there that have been helpful, and but what we need is better evaluation and better scale up. So when we
mm,
know that if these programs work, we also need to be able to scale them up pretty
mhm,
quickly,
mm.
and they work.
Yeah.
Mm.
And thank you for that. That's what Missing School's been trying to do in terms of school connection for children who are experiencing a medical condition is how do you do that at scale? How do you maintain that connection? And not just as you're saying, not just any connection, but the connection that has meaning for the person, the connection that they
Mhm.
want.
Good.
How do you scale that cost effectively and efficiently? So this is a big question, and I'd like to touch on later about the role of technology because I think we're hearing both sides of the story to do with technology, um, to do with connectedness, and to do with loneliness as well. So I'd like to just tap onto that. But I also just wanted to pick up the point that you made about people with chronic health conditions being 2.6 times more likely to experience persistent loneliness.
Yeah.
And so this is when you translate that into the percentage of people that we're talking about just in the general population, but then for a population of people who are experiencing chronic conditions, then it's we're really getting the picture of how important this is.
Yeah, and the work that you guys do is really critical because you're really targeting a group where social connection is everything to children. It's everything. It's so important for them. They will rank it much higher than the parental relationship.
Uh-huh. And that's true. And I wonder if there's a sort of a biological reason for that too, that's hardwired in because
Like,
um, it is
this,
about learning to be human,
yes,
and
yes.
survival and all those
Yeah.
things.
Yeah, all of us have been young and at that age, and if we can remember, relationships are really critical to children, and then as we grow into adolescence, you know, it shifts from the parental relationship to your peers,
Mhm.
and of course we do shift back down the line, of course, but we're really trying to navigate who we are in the context of that wider world outside the family.
Mhm.
Yes, parents can provide the best support, but sometimes it just doesn't feel enough for the young person because
Mhm.
they're just simply the parents, they're offering something different. But what they
Yeah.
really want is that peer relationship, that to
Mm.
have more friends, to be acknowledged, to be seen by their peers. And you might be the best parent in the world, and sometimes you just can't give that.
Mm.
And so that is the struggle. Yeah.
Yes, and I just I think when you say that, what I'm reminded of is the fact that we can feel lonely and disconnected from ourselves
Mm.
and our identity, especially in those teenage years where we're not quite sure where we fit, which
Yeah.
group, where,
Yeah.
who are we shaping up to be, and does
Yeah.
that match the environment around us, and can
Yeah.
we find that being that and this isn't my area of research, but that sort of mirroring effect in the world that we have, which is we see who we are by our relationships to others as well, and our interactions with others. There's something there at the same time. So it really does sort of put more granularity to the conversation that we have here at Missing School about why that peer connection is so important. You've mentioned identity, and a lot of people that we've spoken to on Live and Learn talk about identity from the perspective of different health conditions, and that an important thing is for that person not to become their diagnosis, and to be able to maintain their whole self.
Yes, yes.
And bring their whole self to the world.
Yeah, absolutely. And that is healthy because, we need to have different facets of ourselves to hold us up, and that's what we call self-complexity. We need to have a strong identity as a sister, as a daughter, as a friend, someone who does music, someone who does dance, not just someone who's sick, and having multiple parts of you is really important for our health and well-being.
And thanks for raising that, because I suppose that's one of the things that children who are in a health crisis, or at times in their health journey or in a health crisis, or isolated because of that in hospital, maybe even at home, is that one fundamental thing I hear there is the representation through social connections of different facets of ourselves. And obviously, if you're unwell and isolated, then the range of expressions of that is limited.
Yeah.
So you're not getting the range that you would normally have.
Absolutely. That in itself becomes a lot more compressed or a lot more simplistic. And this is where, that whole buffering hypothesis, sometimes the more complex we are, the easier we are to buffer stress and to cope. But when you have that very simplistic identity, one part falls down, it's very hard to recover. So how do we help children? How do we help people with chronic disease and with health issues to build different parts of themselves in a way that is helpful, and to feasibly do that? We have challenges to begin with. How do we
Yes.
rebuild that part, even if it's within the resources that they have, right? And their abilities and capacity to do those things.
Yeah, I think we have a side effect of Missing School, which is, and I won't get the wording exactly right, but it's susceptible to or at risk of shock. And I think that's what you're mentioning there, which is where that variety is taken away and you're singularly focused, or only have one source or supply of social connection, you're more, well, it's vulnerability to shock, you know what I mean? And that,
Absolutely.
yeah,
Yeah.
effects that has.
Yeah.
So you've talked about some of these, and please feel free to add or discuss further. What are some of the common and perhaps frustrating public misconceptions about loneliness, and how have you seen this impact families?
Yeah, I think a lot of people think that it only affects older people, that you need to experience some sort of bereavement or maybe something negative or loss that therefore then you is more susceptible to get lonely. But actually, even positive events can make someone feel lonely. So things like moving to a new school might be a good thing, a new start, maybe a better school, a new job, a new state, a new country. For people in their middle age, having a new baby, all those things are seemingly positive, can also pose a social challenge. And that's okay if you feel a little bit lonely during that transitional time. It's normal for you to be able to revise your social expectations and challenges and context. So to kind of give people, they should give themselves a little bit of allowance to feel that way. Yeah.
I love that answer. It's so important, and brings back to mind that it is a natural human thing, but often we would feel even more guilty or uncomfortable that the fact that something positive is going on in our life, and here we are sort of feeling a bit ungrateful for it, or like we're not enjoying it, and then we're adding all those layers of narrative on top.
Yeah.
But of
Yeah.
course, because those involve changes in our social interactions and changes of people often, and all
Mm.
of those sorts of things.
Yeah, and I think the second point, and just to add to build on your point, we need to remember that relationships change
Mm.
over time. We should not expect them to be stagnant. And for some reason, we always think, oh, it's this way, so it has to be kept this way all the time. But people change, and you will change,
Mm.
and context sometimes has got nothing to do with the person, but the context changes. So it's okay if you actually disconnect from someone at some point. You feel less close to
Mm.
someone. Like, do not take it as a sign that, oh, it's terrible. Actually, that's normal. It's almost like a wave. Like, we need to kind of ride that wave and build different kinds of friendships, so that we again have that diversity. If you have
Mm.
more than one person, then those when we actually go through those changes, it's not going to affect you as much.
Yes, you'll be less vulnerable to shock.
Again, I love it. We're like that.
Yeah,
The theme
and
of the
uh,
of the day.
it's such a helpful conversation. I know people are going to get so much out of this. It's really something that, I guess, because it's feelings that come and go, that we don't tend to think that we can practice at them. And that I love the fact that you've said out loud that relationships change across life. I mean, it's something that seems so simple, and yet we beat ourselves up about it, and we tell ourselves all sorts of horrible things about it. And even the same relationship um, can change and then change back again.
Hmm.
People
Hmm.
can come, they can go, they can come back again, and
Yeah.
all of this is possible.
Yeah. Yeah. And it's funny because, you and I have probably the benefit of hindsight, but for a child, they do not have the benefit of
That's right.
hindsight.
That's
So,
right.
yeah.
And so I imagine then, and we'll go into this, but uh, being able to create some architecture for children around this feeling of loneliness, and how natural it is, and be able to have those discussions quite openly.
Mm. Mm.
Um, and
Yeah.
I suppose sometimes I'm thinking as a parent that we might also feel affected by our children's loneliness when they talk to us about other people doing things, and
Yeah.
we might
Yes,
be
you don't have the control, and as a parent, you want to naturally protect them.
yeah,
But you
yeah,
know that as they get older, and this is where I feel, because I do have a very young one, that I'm no longer going to be able to provide that refuge. So how do we build them in a way that they have that social resilience on top? That's a little bit of a challenge, isn't it? Like
yeah.
that they should be, and this is the thing, I'm sure you think the same way too, but nobody likes to be disliked, and everybody wants
Oh,
to be accepted, right?
mhm.
But there will be moments where your child is just not liked for whatever
Yeah,
reason, and not through any fault of their own. And how do we give them that perspective, the wider perspective, that it's actually okay, and that it's okay to not be liked by everyone. And we can say all we want, but sometimes they just have to experience it to be able
yeah,
then to digest it. Because sometimes, parents saying things, they just go, nah, in one ear, out the other, or
yeah,
you're just
yeah.
trying to make me feel better, that sort of stuff. So,
Yeah, I
yeah,
always had to put in a personal kind of note to self. My children are older, but and believe me, I didn't get it right all of the time.
yeah.
But to when they were telling me, such and such did this or someone did that, and um, tried to delay criticizing the other person. Because the other thing that happens, to your point, is that today an enemy, tomorrow a best friend, the next day, and so you've got to kind of hold those things quite lightly, because,
Yes,
and I
yes,
suppose that gives them the space to do it. But I can
yes.
see why this work is, um, and what our young people and children are going through today, and the well-being and health crisis out there, be it
Mm,
physical, be it mental health.
mm,
These kinds of conversations backed by scientific knowledge and translated into everyday practice and action
mm,
are going to be just so important for parents to have and for practitioners to have,
mm,
so that we can, frame this up in a more beneficial way, in a helpful way, so that
mm,
you can navigate the ups and downs, the waves, as you say,
mm.
um, with as a practice,
Mm.
so for children.
Absolutely.
Yeah.
Absolutely.
You have given us some incredible stats. I'll just go back over it so we can capture it in this section. How many Australian children and youth are living with loneliness right now? Do we
Mm.
have that number?
We will, we will, and this year because we do need to what we call establish a criteria.
Mm,
But it is estimated. I will just speak to the Young Australian Loneliness Survey that I did. It's around before COVID was around 1 in 3 young Australians that experience loneliness at any given time. I do not know about persistent loneliness in that group, but we do know for the 18 to 25-year-olds, so still considered young people, at least 40% of young people also experience persistent loneliness, but we do not know what the persistent loneliness statistics are for under 18s, which we will
mhm.
release probably at Loneliness Awareness Week this coming year in 2025.
Yes.
But we don't expect it to be much higher or much lower
Mm,
than 18 to 25 year olds.
uh-huh.
Mm.
And will that data collection also capture whether, other demographics, like whether there's chronic illness
Yeah.
in the picture as well?
Yeah, in that particular data set that we're looking at, there are some health variables, but there's also a lot of educational and social variables. And
Mm,
we want to look at how being persistently lonely, for example, for young children and adolescents, actually lead to maybe poorer health outcomes and educational outcomes
mm.
down the line. So when we kind of
Yeah.
look at wave data, we want to kind of look at the prediction of what that looks like for, say, educational outcomes
Yeah.
further down.
It's interesting because from peer-reviewed research, we know that up to 30%
Mm.
of students have a health condition serious enough to affect their well-being and
Mm.
attain education attainment and attendance. And
Yeah.
then we've got the sort of school attendance, current school
Mm.
attendance crisis now
Mm.
globally and
Mm.
nationally.
Mm.
And the Greens Party did some phone surveys, and obviously that's not peer-reviewed research, but there was 40% of young people uh, in the category of uh, experiencing anxiety and other things that were causing them to miss school.
Mm. Mm. Mm.
So there's some interesting. We won't make the association directly between those data because we can't, but I just say that because we're talking about health conditions and the interaction with loneliness here.
Yeah, absolutely. Yeah.
Um, this is one of our typical questions, and I'll be interested in your answer and whether it applies.
Mhm.
Is there a risk of delayed diagnosis? If it is indeed a diagnosis, it's not we know it's not a clinical diagnosis, but um, is there a risk of delayed diagnosis, or are most cases of loneliness,
Mm.
persistent
Mm. Mm.
loneliness, picked up easily?
Um, so yes, you're right. We probably shouldn't call it a diagnosis because
Mm,
again, it's not a pathological condition. But what we do know is that it's very likely that people are underreporting loneliness and
mm,
therefore not getting the help that they need early enough to
yeah.
actually work on the prevention end.
Mm,
As I mentioned before, there's a lot of stigma and shame and concealment.
mm,
But also people, if people are not routinely screened, they're not routinely asked.
mm,
And I mentioned, loneliness is one of those things that we only know if we ask someone. So if we go to the doctor, they're not getting screened. They're getting screened for depression, and sometimes they assume that that is just because they're lonely, they're depressed, and so they get sent to psychologists. And not saying I don't want to kind of badmouth my own industry, but what I'm saying is that it's send someone with depression to a psychologist, but you don't have to send someone who's lonely to a psychologist because that just leads
Yes.
to a waste of resources, and psychologists
Yeah.
are expensive and they're difficult to get to.
Mm-hmm.
So there's a lack of identification in our health system, our social systems, our school systems. People don't routinely pick that up. We don't routinely ask because again, it's still an issue that's really misunderstood. Like, why should we ask them? They're living with a family. Why should we
Yeah.
ask them? They're living at home. That
Assumptions.
exactly. And so because of these false assumptions, we don't screen them. We don't screen them
Mhm.
just because they're living with other people. And now we know different. But it takes about 15 years for practice and policy to really catch up to science. So we're
Mm-hmm.
really in
Mm-hmm.
that gap, the moment,
Yes.
you know?
Yeah. And this is such an important conversation. You can, anybody thinking about this can see the problematic nature of that,
Mm,
and where people can end up simply because they're lonely and may not be able to identify that themselves.
yes.
And then they're not be, and then those who they might be engaging with don't have the criteria or the processes
Mm,
in place to triage through.
yeah.
Have you had a bereavement? Have you had like the first principles or the root causes?
Yeah.
And so we're going straight up to a higher order complex
Mm,
diagnosis of
mhm.
depression. And
Yes. Yes.
then unfortunately, if it is loneliness, you can see how it won't be resolved by
Ex-
that pathway.
And people who do get screened by their GPs for depression often say, well, I was just lonely, but then they were asking me all these clinical questions about whether I want to kill myself. And it just feels really wrong. It feels like they're not really understanding what I'm trying
Hmm.
to say to them.
Hmm.
And it just doesn't feel like the right process for me.
Yes, and another important point. So, um, just wanting to be able to have that recognized,
Mhm.
and then I suppose being um, having things said that are blatantly unhelpful
Mhm.
in that circumstance. It's a wrong pathway, in other words. It's
It's
going down a
absolutely a
wrong
wrong
pathway.
pathway.
Yeah.
Exactly.
Yeah. And I think that could possibly, for some people, based on what you've said, then lead to feelings of guilt or shame, um, or catastrophizing loneliness,
Mm-hmm.
even persistent loneliness, as being depression or
Yes, yes.
something
And
else.
then when you do feel that, maybe some of them are going, well,
Mm.
I need a lot to actually manage this, when in fact they don't need that intensity. They
Mm.
really need just something a lot less intense for them to resolve it. But
Yeah.
ignoring it and not knowing where to go, all those things can really make someone just feel lost about how to seek help and when to seek help.
Yes. And if the amygdala is dialed up, the fear center, the threat, can that trigger anxiety as well, as where
Mm.
loneliness can trigger anxiety?
Yes, actually, the comorbidity of loneliness and social anxiety is pretty high.
Hmm.
There's kind of some debate as well in the scientific literature if that is sometimes the same thing, because what we do see is very similar neural processes like the amygdala being activated, very similar to social anxiety, and the cognition that goes with that is very similar.
Mm.
Um, in a lot of my studies, when I work with young people, uh, people who were screened for being lonely, quite highly lonely, about half of them also meet a clinical diagnosis of social anxiety
Uh-huh.
disorder.
Wow.
So when we think about addressing loneliness, we often also think about screening for social anxiety because um, if you don't do treat that or you don't address that, it's really unlikely that whatever program you put for loneliness is really not going to work because you're dealing with a comorbidity issue that will stop them from really getting the connections that they need.
Yeah.
When you have, as well, on top of that, chronic disease or an illness, I think that's heightened, that
Hmm.
anxiety
Hmm.
and where you fit in, especially when you're a child.
Yeah.
That
Yeah.
all of that is heightened dramatically.
Yeah, so that's one of the biggest issues that students we support face.
Mm,
And one of the things that continuing connection is reported to resolve
mhm,
or reduce is anxiety.
mhm,
So we're also seeing that students who are separated from school have increased anxiety. They're also having a health
mm,
condition and trauma perhaps associated with that. There's a lot going on,
mhm,
but staying away from school and having to re-enter after long periods and things like that increases
mm,
anxiety.
mm.
So maintaining the connection, whether it's digital and physical,
Yeah. Yeah.
actually is reported by parents and teachers to reduce their anxiety. So
Mm,
um, I think this is why your work is just going to be so, so important in this context as well.
yeah. Yeah.
Um, just talking about kids and moving into, you've mentioned some there, but are there other complications for children in the context of health conditions who
Mm.
experience loneliness?
Mm. I probably would put a call out to two vulnerable groups. If a child identifies as LGBTQI
Mm.
plus, they are very much also facing discrimination and bullying on top of that.
Mhm.
Um, uh, it's a very vulnerable group, and we already know from the literature that that group will be, when we compare that to adults, that group is experiencing more loneliness than not. And of course, young people with neurodiversity as well.
Mhm.
I think that there's always this assumption that people or young people with ASD, for example, don't want friends, but actually they do. They dearly would love friends and dearly would love their group. And this assumption that just because maybe they might not have maybe social skills to the same level, that means that it must be their fault. Actually, it's not. It's actually
Mhm.
they can experience and friendships and relationships in a kind of fulfilling way, but they might have fewer opportunities to do that. And how do we better support children of neurodiversity? Because we do
Mhm.
know that that's becoming incredibly common now,
Mhm.
and there must be uh, supports and more assistance for those two vulnerable groups.
Mhm.
Yeah.
Yes, absolutely. And across our work, of course, we have students in both of these categories who also have chronic
Mm.
health conditions,
Um,
um, and of course, what I've been saying more recently is it's not one thing or the other. It's the fact that it's a Venn diagram of issues because some of those people, young people, come from a rural area and they
that's
come from a
right.
low socioeconomic situation. So there's this Venn diagram of issues and sort of not fitting in necessarily into one specific category.
Mm.
Um, and and the bullying as well. So chronic children with chronic conditions, it's reported to be bullied at
Yeah.
higher levels of
Okay.
bullying
Yeah.
than their peers who don't. So
Yeah.
I think you and I could probably talk about some of this for hours, and I'm trying to stick to my questions, but I'll just put a note here to say that um, there would be probably a whole sort of range of things you could say to us about what happens when somebody experiences loneliness and expresses that in the school setting, and how that then negatively affects how peers might treat them as well,
Mm. Mm. Yeah.
compounding that.
Yeah. Yeah.
Um, so this question is the current population of school-aged children with loneliness.
Mhm.
And do we have that figure? And if so, how accurate is that?
Um, Same, I think my response will be probably very similar to the ones before. I think we will probably know a little bit more this coming year in
Mm,
terms of the proportion of school age children. But I just kind of reflecting on international data again that they don't seem to be really differing too much. Again, the vulnerability that we do see in the spikes of vulnerability would be with children with chronic disease, so the existing risk
Mhm.
factors that might
Yeah.
predispose them to being lonely. And you mentioned low income and socioeconomic backgrounds that would absolutely predispose, if someone's coming from the lower socioeconomic background, predispose them to experiencing higher levels of loneliness.
Mm.
Or if we look at just the general population with children that do not have those complex issues, what we have seen typically is that the 18 to 25s tend to have a spike, and that's because of the transition from high school to
Mm.
further education and vocational training.
Mm.
Because your typical school age children are leaving the safety of high school and into a world where actually there's no structure and no social structure and a new way of navigating a whole different landscape, including making friends with people who are not of your same age.
Mm. Yeah.
So,
Yeah.
so we tend to see those typical spikes in the 18 to 25-year-olds in international data and national data.
Hmm.
Mm.
And noting that you're mentioning this in 2025, you'll be able to release more data on
Yeah.
this group.
Yeah, we will absolutely love it when if people do channel into Loneliness Awareness Week, because we're hoping that in 2025 we'll be focusing on young people, so adolescents and young adults.
Yes, and can you tell us when that is?
So Loneliness Awareness Week is held the first week of August every year.
Yeah.
So we do have a website that's lonelinessawarenessweek.com.au that we actually host. And right now, people can actually already get resources, which is like, how do you spot loneliness? How do we talk
Mm.
about it? Loneliness doesn't have a face. People of different diverse cultural backgrounds talk about loneliness. To be able to make sure that we don't see this as just high income country problem as well. This is a global issue. We
Mhm.
really very much want to make sure that we start changing the lingo, changing the language that we use when we talk about loneliness.
Mm. And do kids with loneliness, school-age children, if you know, currently miss a lot of school? So
Hmm.
um, this is a bit
Yeah,
of a complex one, I guess, or maybe it's not.
I think there might be some data around school refusal and loneliness, from
Mm.
my understanding. Um, and I think that might be UK data. I haven't analyzed that within the Australian data set, but I would imagine loneliness would be heightened, especially when there's a disconnect from their peers. And as I mentioned before, the peer relationship for children and adolescents are probably starts to get more and more important. And not being at school is incredibly distressing for some young
Mm.
people, and
Mm.
some of them is not something they can control.
Yeah, that's right. Yeah, in those cases, and we have a point of view on um, the labeling that goes along with school non-attendance, and
Mm.
some it's in many ways can be about the actual coding of attendance and the way children's absences are coded, whether it's an approved medical reason or it's unapproved, meaning there's no diagnosis from a doctor, so there's no reason, which of course is not a straightforward thing, as you pointed out earlier, where sometimes even there's an invisible illness, or there isn't a diagnosis yet, or it's chronic anxiety. So the labels that are given to children for being away as well also complicate this conversation, don't they? And unhelpfully so.
Yeah, absolutely.
Mm. Just rounding off, you've been so generous in terms of the information and pointing to the data and stats that you've shared. Um, are there any particular times in a child's life? We've talked about adolescence, we've talked about illness. Is there anything you'd like to add to those critical times and what families should be prepared for at those different times to do with loneliness?
Look, I think I think children, regardless of their health status, are all they all are wired and hardwired to connect, right? So if they don't get the peer connections that they have at school, it's about thinking about how we can help them develop new ones outside school or in their community with other kind of extended family or friends or friendship groups that a parent can start to give them options, and again, we need to need to teach young children about social resilience, about managing realistic expectations of what relationships look like and what they can how they can change, and how it's okay to have someone potentially pull away from you, and also that they might be doing it themselves. And how do we teach young children to do what we call a proper social hygiene? Now, we all know how to do it, but we don't necessarily practice it ourselves. So what are the kind of skills that will help them nurture meaningful, healthy social relationships? And to be able to also be navigating, how do you move away from relationships that don't work anymore, that might be a bad influence on you,
Mm,
bad for your health, that they can find acceptance and belonging in other groups and friendships in other areas that might be better for them. And how do you navigate, and how those pathways are possible? Because I
mm,
think that, again, you know depending on the circumstances and the context, we can build some complexity into the child's world at some point, or at least offer, or at
mm,
least show there are other pathways. We can't control everything as parents, but we can draw lines and draw little pathways that might offer your child different options. And that is not just always black and white. There are all these shades of gray as well.
mm. That's so important, and we'll be able to point to your website and places where people can find things, especially that social hygiene practices and things like that. The really tangible things that people can do to not end loneliness for themselves, because as you said, that's not a goal we even need to aspire to, but just to be able to navigate our relationship with loneliness in a more positive and capable way. And I just I can't help but think that your work must go into schools. It just must be
Will.
taught.
Yes, we're
And
really hoping it will. So,
yes, and I look forward to having further conversations with you about that, because we know that a lot of trauma-informed practice work is going on in schools, and that's necessary and essential and important. Um, we'd also love to see more of this social resilience, and being able to give the toolkit of how to navigate through what is um, not only essential to us, but is unavoidable, and that is social relationships. It is
mhm.
just, this is what we need to do, this is what we have to do. And, so I guess that brings me to the next question, which is just before we head to close out. And that is, do you think that these vulnerabilities that children are experiencing, some are natural and then some are more persistent, and in the area of loneliness, do you think that what's currently happening out there or happening in schools is enough right now to do with this?
It's probably not enough.
Yeah.
I can tell you that's probably a gap. Because, you know, parents don't even know what the word is and how to have those discussions. And the awareness of tackling this is not just a you problem or an I problem. This is everyone's problem.
Mm,
Schools are active participant in this. Our communities are, our workplaces are, wherever parents have touch points and teachers, the ecosystem of the young person. It's not just the young person themselves. We all need to be having a proper conversation about what that looks like. How do we address it? What do you mean when we want to address loneliness? Maybe what we're talking about is persistent loneliness. How do we build an environment that helps young people and children build meaningful social connections healthily?
Mm,
They might go through those changes of connecting and disconnecting, but they are still able to be resilient enough to find new friendships and don't have barriers set up for them. And if they do have those barriers, what can we do to actually remove those barriers?
mhm,
What kind of
mhm,
policies can we do within schools that means that young people with chronic disease do not miss out, do not actually, that they can still meaningfully engage, even if they're remote? All those things are so important because, as you know, children and young people, they're so diverse. So how do we cater to that diversity? It's really critical.
mhm. Yeah, thank you so much. I'm picturing like a course at school that's called How to Be a Human, and this is 101.
One-on-one. But we're developing something right now, so hopefully, that will
But
be.
yeah, but seriously, it's really because these things occur so naturally for us, we think that we should just be born knowing and that we should just be capable,
Yeah.
and then we avoid all of the opportunities that you're talking about to actually become better at
Mm,
connecting, to
mm,
find ways to resolve our loneliness, healthy
mm,
ways to resolve our loneliness without shame, without blame. And that excites me so much, especially for our work, because it's
mm.
so much in alignment with what we're
Yeah,
doing.
absolutely.
And we know that this is a social prescription, like school connection and maintaining school connection is a social prescription um, for social connection. And we also know on the other side of it is that peers in the classroom also benefit from a
Mm,
person who's away
mm,
rejoining the class, even through two-way digital
mm,
technology connection.
mm.
Um, because we're getting close to time now, I won't go into it, but I would love to, if you will, invite you back so we could have a conversation about the role of technology and maybe, what that might look like, simply because when we talk about using technology to connect children to school, sometimes, even from policymakers, we kind of get this knee-jerk reaction that is technology is bad for young people, it's causing isolation. And I get it. I get that there's a lot of narrative out there about social media and other things. And
But
um,
things are never as simple and they're never as black and white, are they? Making
no,
anything about
no,
it.
that's right. It's kind of like the era of prohibition to do with alcohol, and then um, that didn't stop people consuming alcohol. And of course, there's a whole gradient of levels of where that works well and then it doesn't, and so on. And I tend to look at technology in the same way. It's not good or bad. It's the applications and
It's
the
how you use
ways, and
it.
it's how
Exactly.
you use it and what use it's being put to and all those sorts of things. So I look forward to more conversations on that if you're willing to engage in that.
Yeah, maybe we could have that during Loneliness Awareness Week. That would be
Yeah, yeah,
cool.
for sure. Um, because your work is just right at the centerpiece of what we're doing and why we're doing it, and also um, bringing the science to it and making sure that evidence is speaking through that translation to practice.
Yeah, and thank you to you and your team for really doing this really important work. I really love your mission and I love the values that you guys hold.
Mm.
And it seems to like you guys are doing fantastic work. So I really know that young kids who are vulnerable, who have, illness, really have this opportunity to kind of participate back in school because of you guys.
Well, we really want to take it into the UN now. That is our background.
Yeah.
Myself and our impact director came from the international development space. So
Mm,
it's a message that we want to, and data that we want to share internationally, because this is an issue across
mm,
developed countries and, as you said, just everywhere.
mm,
So
mm.
we have a lot to say now, and but I guess that what that leads me to is through your incredible generosity today. And thank you for the work that you've done through your career, that you honored that urge to move into this area and the value that that's bringing at a time in history where it's just right at the forefront of everything. And so you're ready, all of the work that you've done makes you ready for this moment. And everyone is grateful for that. So as we close, is there anything else we should be asking or talking about in loneliness that we've missed that you want to slip in here?
No, I think for parents who are curious, for teachers who are curious, really start to learn about it, talk about let's develop a healthy language about it. And if people would love to help guide the work, share their experiences around this topic with us, please feel free to reach out to me. We're really always interested in collaborating and interested in channeling the lived experience and getting people's, delivering things that really make sense to people. We don't really want to deliver anything that doesn't make sense. So, if there's anybody who's interested in reaching out, feel free to email me. It's michelle@endingloneliness.com.au.
Thank you so much. And we'll put that in the notes. Do you have a call to action for loneliness in 7 words or less, Michelle?
We need a national strategy to address loneliness and social
There we go.
isolation.
That's
We need a
amazing.
federal national strategy because we are falling behind Australia, and we are one of 3 countries that has the economic costings of loneliness and social isolation that costed at $2.7 billion. But we are also the only country that does not have a strategy. So
Well,
we
Michelle, that's something you and I can work on together because
let's do that.
yes, I was recently awarded the 2025 ACT Australian of the Year and for the work, and I really have an agenda, and it sounds like yours and mine
Oh,
have
yes.
a
That's
great alignment.
I love, and so we are connecting, Megan. So
We are
you and I have
connecting.
shared values and shared interests.
Exactly. And there you go. I think that's such an amazing place to land, which is the meaningful nature of social connection. There has to be meaning made in the
Yes,
connection for it to
exactly.
be effective.
Well, this is the highlight of my day.
Yes, and indeed mine. And look, as I said, our absolute and sincere praise and thanks to you for your work. Um, and maybe we're making a course about how to be a human 101.
I love it. I love the title.
Yeah. And a shout out to Ending Loneliness Together. You can find that place on the web, on the interwebs, endingloneliness.com.au. Thank you for joining me today, Michelle, on Live and Learn. It's been an amazing conversation.
Thank you so much for having me.
Thanks everyone for tuning in. Help us turn up the volume so all kids are seen and heard. Follow along, like, share, comment, or leave us a review because we love hearing from you. And if you want to donate, head to missingschool.org.au because every dollar makes a difference.